Monitor your temperature for fever. Most people who have been confirmed to have COVID-19 have had a fever, which is any temperature that's higher than your normal body temperature. The average body temperature is 98.6 degrees Fahrenheit, 37.0 degrees Celsius, although your normal temperature might be a little higher or lower than this. The most accurate way to determine whether you have a fever is to use a thermometer, although you might also watch for symptoms like sweating, chills, muscle aches, weakness, or dehydration. Pay attention to signs of respiratory illness. The most common symptoms of coronavirus are coughing and trouble breathing. Other symptoms might include nasal congestion, runny nose, sore throat, and exhaustion. However, since these symptoms can all have a number of other causes, it's important not to panic just because you're experiencing them. Evaluate whether you're at high risk for coronavirus. Currently in the U.S., people are considered at low risk for contracting COVID-19 unless they've traveled to an area that's been affected by the disease or they've been in close contact with someone who has a laboratory-confirmed case of coronavirus. Additionally, your doctor may recommend you for testing if you have respiratory symptoms, especially if you test negative for other conditions. As of March 2020, the areas with the most active cases of COVID-19 include China, Iran, Italy, South Korea, and most of Europe. Consider whether you may have been exposed to another illness. Just because you're sick doesn't necessarily mean you have coronavirus. If there have been no known cases of coronavirus in your area and you haven't traveled recently, the chances are high that your illness was caused by something like the flu or a cold, instead. If you have a coworker who recently tested positive for the flu, for instance, it's much more likely that you also have the flu than COVID-19. Call ahead to your healthcare provider if you think you may have COVID-19. If you're experiencing respiratory symptoms and a fever and you have reason to believe you may have been exposed to coronavirus, call your primary healthcare provider and let them know you'd like to come in. Calling ahead will alert your physician and their staff so they can take steps to ensure no one else gets sick, and they can also give you instructions on how to proceed. Your doctor will not be able to test you for coronavirus. Visit the appropriate lab as directed by your doctor. The tests for coronavirus are currently not being distributed to hospitals or individual healthcare providers. If your doctor determines that you meet the criteria for testing, they will contact your local health department and will give you further instructions on when and where you should go for testing. Be sure to arrive at the lab at the specified time. Unless otherwise directed by your doctor, there are no special pre-test instructions you have to follow. Allow the technician to swab your nose and throat. The primary tests for coronavirus are nasopharyngeal, nose, and oropharyngeal, throat, swabs. During these tests, try to hold as still as possible while the technician uses a swab to collect samples from both areas. While you might experience some discomfort, the test shouldn't be painful. The technician will have to hold the swabs at the back of your nose and throat for 5 to 10 seconds, which may feel slightly uncomfortable. Provide a sputum sample if it's requested. If you have a productive cough, the lab may request a sputum sample. To provide this sample, first you'll rinse out your mouth with water, then you'll cough up a sample into a sterile collection cup. In rare cases, such as if you're experiencing severe respiratory distress, you may have a saline solution sprayed into your lungs in order to obtain a sputum sample. However, this is not common for people with only mild symptoms. Wait for the test results. Once you've provided the appropriate samples, the laboratory will package and ship your sample to the CDC or an approved lab overnight. The sample will then be tested, and you will be notified as soon as the results are available. The original lab may do initial testing to rule out another respiratory illness. If they determine you do have another condition, they may rule out coronavirus immediately, although these guidelines may change as more is learned about the disease. Follow the treatment plan advised by your doctor if you test positive. There's currently no treatment or cure for coronavirus. However, your doctor may recommend treatments to help relieve your symptoms and prevent them from getting worse, so be sure to follow the recommendations closely. If your symptoms become severe, such as if you experience severe difficulty breathing, your doctor may recommend that you be hospitalized so you can receive more intensive treatment. Take precautions to avoid spreading the illness. If you're ill, stay home except to go to your doctor, and try to stay isolated in a separate room from other family members. Cover your mouth and nose with a tissue anytime you cough or sneeze, then throw the tissue away. Wash your hands frequently with soap and water, and sanitize the surfaces in your home to avoid spreading germs to others. If you're sick, wear a face mask to avoid spreading the virus to others. However, do not rely on a face mask to keep you from getting sick if you're healthy.